In terms of testing capacity, the government announced that teachers and staff in schools are classified as target groups. I find the arrangement acceptable so long as the testing is voluntary in nature, but as a legislator, I would look at the use of resources and whether it is proper. Recently, I had discussions with healthcare personnel in universities. They are surprised why teaching staff and school staff are considered targeted groups. They are considered low risk. And there were very few cases of them being infected, and that might be due to their simple way of life. If you are to protect students, well, they would come into contact with other students in school, and we might have 30 to 40 students in a classroom and a single teacher. So if you tested the teacher, you are not doing much to minimize the risk. People could be infected anytime. So in terms of priorities, we don't understand why the emphasis is on school staff and teachers. I assume that the testing will be carried out by the government. Is it that we have sufficient public testing capacity and there is no need to turn to the private sector? Or was my assumption wrong? That is, the teachers and school staff are not considered low-risk groups. Is it the case that we have ample or even excessive public testing capacity already? First of all, each bureau would decide whether they would conduct testing for any of their units, so this is something I cannot answer on their behalf. In terms of public testing capacity, it is constantly improving. The public sector has its hands full dealing with its current cases. For suspected patients or persons in quarantine, they would be dealt with by the public sector. Apparently, the Education Bureau made the decision you did not come up with a decision after assessing all the different sectors or groups in Hong Kong. I was rather surprised because I thought the decision was a scientific one. After assessing the needs and risks of different groups, for taxi drivers, I understand why they were included, because they come into contact with different people every day. They would be regularly tested, and this is to minimize transmission. We have a lot of school staff and teachers, and after a single test, I believe they would not be tested again within a short time. I thought the government had compared the risks among different groups before arriving at the decision. Undersecretary, can you confirm that the decision was solely made by the Education Bureau instead of a decision upon completing comparisons and assessments? The government had explained the context of the targeted group testing. The idea was to pinpoint the scope of testing in order to achieve a better yield. So the government established certain principles, for example, high risk or those with frequent contact with others, those with contact with public facilities like cargo terminals. In arriving at a decision, a bottom-up approach is adopted. It is not something decided by the Food and Health Bureau. I understand that teachers might be considered to come into frequent contact with others, including students, so that might be the reason.